So, very good evening, everyone. I hope this is weekend and you guys must have planned something for the weekend. But today we are starting with this live session on nutrition, role of nutrition. Does nutrition play a role in hair loss? How your diet is, concerned with the hair loss. Is there a direct relation or not? And many times there are a lot of questions around hair loss and diet. Certainly, diet plays an important role in overall hair health, and many times we have noted that because of certain deficiencies in the body, it has started to affect the hair health directly, and there has been a lot of hair related issues such as hair thinning, hair fall, even in people who have got their transplant and somehow their nutritional level were not met post surgery, they have also experienced loss of hair post transplant. So now, what are the important dietary factors that play an important role when we talk about hair health? So we have been always taught that if you eat nutritious food or protein-rich diet or having adequate macro and micronutrients, you're able to maintain your hair health. And it has also been noted in people who have deficient nutrition, and once they get back to a good healthy nutrition or diet, they are able to see the reversal in the overall hair health and hair problems. Now, when we see the basic architecture of hair, it is basically proteinaceous content, uh, which gives you the nails and the hairs. Now, few of the important nutritive factors which plays important role is vitamin B12, vitamin D3, your iron level in the body. They play a major role in overall hair health. So, if someone who is vitamin B12 deficient, they certainly experience hair related issues such as hair thinning and hair fall. Also, the girth of the hair, they become thin, and it gives a lack of luster kind of an appearance in the hair, which makes a hair look dull, frizzy, and often people also complain that the hair have become wavy because of the deficiencies or unmatched dietary requirements through the food. Since particularly people who live in bigger cities like Delhi NCR, here we have noted that most of the people have these basic macro and micronutrient and deficiencies. It could be because they are not able to meet up the daily requirements through their diets, or because of the unhealthy lifestyle, or they are eating everything, but yet because of the poor quality of the food available throughout the city, they are not able to meet up the daily requirements. So when someone comes to us for consultation for hair thinning or hair loss, or in a stage where they require hair transplant, few of the basic investigations that we get done is a general blood profile. Along with that, we check for vitamin deficiencies, serum ferritin, and all. Now, when we come up and in the reports, we see that there is certainly some deficiencies. So we add up those supplements into the diet, and we keep a regular follow up, and we keep on checking the levels of these important multivitamins which play important role for the hair health. Now, many people who are vitamin D deficient, uh, so if I talk about previously, we used to play in sun early in the morning. We used to go for walks. So over the period of time, because of the work-life balance and having adequate sleep, now we don't get early in the morning and go into the sunlight. Sunlight is a major source of formation of vitamin D3 in one's body, and that helps to a great extent maintaining the vitamin D3 level. But since now we don't go out in sun, we don't sit a lot in the sun early in the morning. So naturally most of us are vitamin D deficient. So generally, people who are vitamin D deficient and they report to us with vitamin D deficiency, we add vitamin D3 supplements. They come in syrup or tablet form, needs to be taken once a week, and generally we add up for at least 4 to 8 weeks depending upon the deficiency level. People who are severely deficient, in those people we do add up injections for vitamin D3 as well, which needs to be taken 6 monthly or 1 yearly depending upon the deficiency level. Similarly, for vitamin B12, we do add vitamin B12 supplements in the diet, that is basic dosage of 1500 micrograms every day for at least 1 month, and then we get the test redone and we see whether the levels have improved or not. Along with that, we advise people to have these vitamin B12 and D3 rich diet, include milk in their diet. Along with that, increase green leafy vegetables, and people who are non-vegetarians, they can certainly add up chicken and eggs in their diet. Plus they can even try having fish is a good source of these micro and macronutrients, so they also add up to the overall nutrition to the individual's chart. Uh, some people do experience hair loss post certain diseases, such as who have just recovering from dengue, or they have typhoid, or they have any other illness where they were suffering from prolonged fever and all. So again, once the body metabolism gets disbalanced because of the disease, such as the ones I mentioned, then also certain nutritional deficiencies can be seen, and accordingly we need to manage those daily requirements so that we are able to restore the hair health. Post COVID, we noticed a lot of people complaining of hair loss because of COVID infection. That was one of the special categories of hair loss that we have noted post COVID, and we added with dietary requirements, supplements. Along with that, we added in clinic treatments such as GFCs and PRPs to help these people to maintain their hair health and regain the hair density and hair strength. Many times, a lot of people come with a lot of frizzy hair, where they complain, doctor, my hair has become wavy and they are not growing long. They have become brittle, and they when I tie my pony, I don't see the girth or I don't see the volume. So mostly, if your hair is brittle and they're frizzy, iron deficiency could be one of the answers for that. So do check for iron deficiency if you are having similar kind of hair, and you can consult one of the doctors who treat your hair issues. You can consult us, you can drop us with messages, doctor, with the problems that you have, and certainly we would like to help you with the issues that you have. Even for post transplant patients who feel that their hair have become thin again and they are become frizzy, they can also get themselves checked for these levels, and if there is deficiency, they can uh, restore them with the supplements. Along with that, if someone who have been experiencing hair falls for long period of time, and they have not tried non-surgical therapy such as PRP or GFC or mesotherapy, they can certainly get in consultation to seek one of these treatment, because in our experience we have noticed that GFC has helped to a great extent to a lot of people who are experiencing early hair thinning and hair loss. And GFC and PRP is one of the modalities which is acceptable globally, and it doesn't have any downtime. It's a quick procedure. You come, you give your blood samples for the PRP or GFC preparation, and then you can get the injections done, and you can leave in an about hour. So that certainly helps to have a good hair health. And once we have reached a stage, or we have balanced out the nutritional deficiencies, then we keep you on maintenance, where we decrease the amount of supplements that we have prescribed, and then from there we can maintain the hair health. People who are in a stage where hair thinning has gone to an extent where the scalp has started to show up through the hair follicles or the strands, in those scenarios hair transplant could be the right choice of treatment for you. But again, it depends patient to patient what is their need or what is their criteria for the resolution of the problem. If I talk about hair transplant, basically, again, depending upon the grade of the hair loss, we discuss upon how we're gonna do the transplant, what is the amount of follicles that are needed for the transplant, what should be the area that should be covering. So all these need thorough evaluation, and based on that we finalize how much follicles and what area we need to transplant. And then post procedure we help you with the maintenance of the transplanted hair as well as the existing hair that is present on the scalp. uh, and yes, certainly nutrition has its role to play. So we advise to maintain high protein diet along with nutritious food, and for few months we add on the supplements, but uh, gradually we wean off the patients from the supplements in due course of time, so that they are able to maintain the health without the supplementation. However, we often advise of minoxidil or any topical solution, or which is procapil or procapil based, so that that can be used again in cyclic fashion to maintain the hair health. So guys, if you have any issues relating to your hair, where if you have been noticing hair thinning or hair loss, or you feel that there is something wrong with the hair and you are not able to decipher what is wrong with your hair, you can certainly connect with us, drop in messages on our WhatsApp, or you can write in the comment box, and we would like to answer your queries so that we are able to help you. Even if you want to see us in person, you can certainly connect with us on this numbers given, so that we are able to give you appointments and meet you in person to help you with your hair issues. So thank you guys joining for this live session. I hope I am able to clear some of your doubts pertaining to your dietary requirements and nutrition level in relation to hair health. So stay tuned, and we love to come live with these interesting topics and help you out making a decision in these situations where you have been having issues related to your hair, or any aesthetic related issues, or if you have any uh, maxillofacial plastic surgery related issues, you can always ask us, and you can send us messages on our WhatsApp number. Thank you guys, have a good day.